Okay. Good afternoon, everybody. Um, I think we have a really special treat here for us today. I would like to introduce Leonor Cedillo, who comes to us with a really long history in working in occupational and I guess environmental hygiene in Latin America. I'm just going to read you her bio here. She was a founder and an active member of one of the first NGOs in Mexico, the goal of which was to collaborate with workers' organizations in evaluating and developing proposals for improving their environmental health conditions. She was the chair of the Department of Occupational Regulations from and a subdirector of the Occupational Health and Occupational Health at the Mexican Ministry of Health. She was chair of the Department of Toxicology and Industrial Hygiene at the School of Public Health of Mexico, and she was also a professor there. She's a founder of the Mexican Association of Industrial Hygiene. She has led in areas of risk assessment and general directorate of environmental health with the Ministry of Health. She was a director of research of chemicals and ecotoxicology at the National Institute for Ecology and Climate Change. She is currently working in Vancouver as an environmental health consultant for national and international organizations, including the United Nations Environmental Program. So welcome. We're looking forward to this, Leonor.
Well, good afternoon, everybody. Thank you very much for the invitation to the organizers of the seminar. And it's a pleasure to be here. And I will talk with you about this topic that is a broad topic on women work and health research in Latin America. So the content of the talk would be basically to give you an overview about the women work and health research in Latin America, the most and least common topics addressed in this research project, and the variety of approaches. Also to highlight the narrow boundaries between the general and occupational environments and the narrow boundaries between public and private spaces. So I organized the talk basically giving you, focusing in 4 examples that go into that research a little bit more detailed. One related to occupation where women are overrepresented. Another in occupation where women are underrepresented. Another related unpaid job, and the last one related to unpaid work. So the sources of information that I try to use for this talk were these that you could check in the slide. But really at the end I am using some examples from the special issue that we published in the New Solutions Journal in 2010 and the book on gender, work, and health published by the University of Chihuahua and the Institute of Ecology in 2011. There are some references about the other materials, but basically the 4 examples that I will share with you come from these publications. So the shared knowledge that is the base for this area of research is that women enter to the labor market more recently than men, even if that happened some decades ago. That work and occupational health risk has been designed, measured, and studied according to main characteristics, needs, and work activities, and haven't been fulfilled, of course. Health research prioritizes male studies in certain areas, such as cardiovascular diseases, and women studies in some other areas, such as reproductive. And inequalities in job access, job promotion, paid work, and working conditions to the women women at disadvantage, and that is still a fact in many countries. And the biases regarding women's capabilities and biological functions affect women's job opportunities and professional development. And inequalities in workload related to family, household, and some community activities part as well. And women and men are over or underrepresented in some positions and sectors. Women and men have different exposure even in the same sector or in the same job positions. And these differences have not been studied appropriately in many of the mixed population studies. So there is a need to include gender analysis in order to understand and address women's and men's needs in the workplace. So here there are some examples of the gender distribution of women and men across economic sectors. Of course, this varies among countries. And so, but men are more present in construction, oil industry, truck drivers, as a truck drivers or taxi drivers, metalworking, in the financial market, and also in the high-level positions in multinational companies. And women are more numerous in occupations such as working in the education and health sector, manufacture, particularly some low-skilled positions, personal services, and paid domestic work. So in 2008, 6 years ago already, we organized in Mexico the 5th International Congress on Women, Work, and Health. And we had participation of more than 600 people and representing more than 43 countries. And the main topics that were discussed in the Congress were related violence, domestic work, women in non-traditional occupations, sexual harassment, mobbing, caring and nursing activities, researchers, telephone workers, maquiladora workers, stress, job inequalities, early aging, and there was a big interest and discussion about the instruments, tools, and indicators that must be used more standardized through the different countries in order to have more interchange, a better interchange. So the first example that I'm going to discuss a little bit more is where are the works where women are overrepresented, and one of them that it is women working in manufacture in foreign investment assembly plants that are highly spread out in developing countries. And in Mexico, we named them maquiladoras, and well, also in Central America, known by this name of maquiladoras. So it is still an industry that is highly dominated by female workforce. And it was present in northern Mexico since the 50s, but it had a very big increase in plants there between the 74 and 85, and then they maintained an important number of plants there. They had extended to southern Mexico, Central America, and the Caribbean, and still are part of the interest of many researchers in women's work. So the main aspects which have been studied there were ergonomic risk factors, the psychosocial risk factors related to stress, chemical exposures, reproductive effects, staff turnover, and more recently, aging workers strategies. So here you have how the number of these employed workers increased between 74 and 2006. And we could see that from 74 to 85, the population, from 74 to 95, the population grow, employed population growth about 9 times, and from 95 to 2000, it was the double. So the increase of this type of employment was very rapid, and that was mainly with plants in a region that was not previously industrialized. So that was a complete change of the community's structure, and it was generated some changes more than the ones that we could see into the plants. Here is the number of employed workers. Only all of them are blue-collar workers. So all other type of employment is not here in this table. And we could see the proportion of women and men in these plants. So during the first decade, from 74 to 95, female workers were about 85% of the employed workers. And then the industry has been changed. There is still a predominant industry in the region, but the number of women and men are more equal, but also the type of production have changed a little bit for production that it is more technological production than in the beginning. So what about the research on the maquiladoras in Mexico? So during the 70s and 80s, only a handful of anthropological studies were conducted that were very useful to highlight the attention of the possible problems that were generated there, because there was the employed women were mainly very young and coming from rural areas, from other rural areas of Mexico. So the internal migration were very high, and the training and the factories were not so good, and neither the conditions of health and safety. So over the following 2 decades, there were about 30 studies that have been reviewed that provide some quantitative information about the main risks, the risks that I have already said to you in the slide before, regarding stress-related factors and musculoskeletal disorders and ergonomic risk factors, and a couple of studies on reproductive effects as well. However, in this, we made a review of all these research that we already contributed to, but now we have more questions related the health, public health effects of this type of development, since it is a type of development that is carried out in many developing countries, and it has, at least in Mexico, we think, an effect on the public health profile of the population in this area, in this region of Mexico. So and now the balance is that, or the balance at this time was that we did not generate enough data, enough quantitative information or data that would be conclusive enough to support a conclusion about about the type of development. So how we could use to influence decision making for the regional development, and how this changed at a time when the industry came into, and how were the costs and the benefits in terms of health for the population. So now I will go to an example of where women are underrepresented. And so we have in this publication that I said, two studies published in our book related to sectors where women are underrepresented. One of them related to the social construction of occupational stress among workers in offshore platforms in Mexico. That project was based in deep interviews, and author discussed important differences in between women and men related to the occupational environment, but also to the conflict feelings of guilty and worries of the women because they're dependent in their families. Another study discussed the job that women in Colombia perform in the artisanal mining activities and the related health risks. I will present here to you an example of women who are in positions of political representation in Bolivia. And author referred that the women in Bolivia represents 40% in the economically active population. However, it's not they are not in a similar number, in a similar proportion in public political representations. So this was a work or a study just for changing the problems that they have, that women in political representation had in Bolivia at the beginning of the 2000s. And the harassment of one female member of a city council by a municipal authority led them to create an association. This association was documented all the cases of harassment that these women suffered at that time, and review the law and check that they didn't have any warranty under the law to be defended of this type of cases. So the legislation did not cover the political rights of women, and they documented the cases of harassment in Bolivia of women in political positions. And here you have an example of what they found. They suffered about pressure to resign the positions. They suffered about acts of violence or abuse of authority, etc. So they documented the cases during a period of 6 years, and after that, they proposed a bill to assure some protection of these women in fulfilling their work. So the situation in Bolivia had improved by 2010, and they have so many more representation in the bodies, in the representative bodies, such as the 50% female in the cabinet, and the Senate has they were 47%. So it's even higher than in some other countries. And this experience was shared with other associations and women in public positions, and was adopted and adapted in Ecuador to work with that type of law as well. So now I will go to an example of unpaid work. And unpaid work has been a long time issue in women's research. Either the combination of paid and unpaid job, or when the work they perform, all of them is unpaid. So unpaid job often is referred to domestic duties, but such duties could be developed in the house or outside the house. Uh, and demographic changes in many countries' populations creates a particularly increasing demands for families to take care of the elder people. And this work is particularly done by women. Domestic work has generated a variety of approaches to study from economy to psychology and other disciplines. One work published in our book was a systematic review of 53 research studies of women pesticides exposures and effects in Central America. It was noticeable that many of the environmental exposures in the reviewed studies could be related to unpaid work activities conducted by the exposed women. But it was not enough information in the studies about other women activities outside their paid work. So it was not possible to realize how much of these exposures are due to the unpaid activities. And I'm going to refer with more detail now to a research in Mexico that was conducted as an intervention for changing the type of cooking of women in a small community in the state of Michoacan in Mexico. So these women used open fire for cooking, and this has a very important pollution contribution. So, so the change before the intervention and after intervention was measured. So the reported results were based on two research projects. One presented the actual measurements of particulate matter in the size of 2.5 micrometers, and while the other contributed with a report of health symptoms. So the interesting thing here is that there were measure the activities of women. All of them were unpaid work, and the microenvironments where they developed such work. So they spent 54% of their time in the bedroom, and besides that, the time for resting, that was the place where they brought and make some clothes for selling. So that was the work in that microenvironment. Then 90% of their work was in the kitchen. 14% of their work was in their courtyards, in their homes, and that was mainly growing plants for their own meals. And the general environment, they spend about 10% and 3% in other areas of the house. So here you have the concentrations of particulate matter. And you could see that it is scary. It is very high. Just looking at the average, you could see that aside from the fireplace, there were almost 700 micrograms per meter cubic. That is about 10 times the permissible exposure limit for 24 hours. And after the intervention, it was reduced to the third. However, it is still very high. but looking at the time, at the women's time in each environment, it is possible to look at how was the personal exposure of these women. And after the intervention, the personal exposure reduced from reduced to 74% or 50%. And also the symptoms, the respiratory symptoms. So different from this case of the stops, we had this other that I referred that was the related to the research on pesticides exposure that didn't took into account which of the exposure was due to work, even if that would be unpaid work. So now I'm going to refer to the confluence of paid and unpaid work. And so some of the topics or the issues that researchers have focused are related to stress, for example, spillover between responsibilities at work and responsibilities at home, the emotional demands of these responsibilities, and family work conflict or work-family conflict as well, and some other types of measurements related to stress. But also working hours have been an issue of paid and unpaid work. And recently the use of time that for women shows more hours of work than for men in many of the statistical sources in the countries. Related to health effects, it has been highlighted the exhaustion, the time for recovery, and psychological strain symptoms. And other side effects, not directly related health, and the reduced opportunities for developing a career. One of the studies published in our book was related nurses and the time of recovery in this group. So looking at the workload and working hours in paid and unpaid work. So there, here you could see how the work was developed, and we have some exposure variables. So the authors look at occupational work hours, the domestic work hours, total workload, like the sum of occupational and domestic work hours, and housework overload. The overload was looking at for the complexity of the task and for how many people they are caring of. And the need for recovery was based in a scale of 11 dichotomized questions. Something like at the end of a working day, I'm really feeling worn out, or I find it very hard to relax at the end of a working day. So they found differences between the groups in a prevalence ratio that were observed for work schedules, total workload, domestic work hours, and housework overload. And they found an important relation with the full recovery from work, like every hour of increased domestic activities and of total workload corresponded to an increase of 1.5 and 0.6% respectively in the prevalence of a high need for recovery from work. And in relation to housework overload, they also found an relationship. And it is interesting that authors discussed different conclusions than other a couple of other studies, but that were conducted in the Netherlands and in Germany, I think. And they discussed that the heavy, the workload at the domestic sphere was heavier in this country than in those other countries that usually have more facilities to do their work a little bit easier. So what I am highlighting here is that there are some advantages and limitations of research on women work and health topics in Latin American countries. But we just had a very superficial glance of some examples of what this type of research is conducting in these countries. And I highlighted the point that there are some occupations that are more where women are overrepresented, some others where are underrepresented, and the unpaid work has not always addressed or looking at their benefits and their risks as well. So some advantages that I could see in the women work and health research in Latin American countries are that there are multiplicity of approaches. So that is an accepted topic as an interesting topic and the topic that needs to be addressed in the projects. But there are a multiplicity of approaches to look at that through different angles. And the collaboration, this has led to also to a collaboration between researchers from different academic fields, and also that work very close to some worker organizations. So many of the projects that are short-term projects are applied to solve specific problems of women, different type of jobs. And there's an interest in generating applied results from the part of the researchers as well. And there is an interest in influencing policies. So all of this is like advantages of this topic and how this topic has been addressed. But some important limitations as well. So there are limited budgets for research in general, for research in Latin American countries. There are, in many cases, weak union organizations or union organizations who are not very interested in including in their agendas the topic of occupational health and the health problems of the workers. And the projects tend to be short-term, basically multiplicity of cross-sectional projects, very few long-term projects and cohort studies and so on, and few national sources of information, I mean specific sources of information, such as surveys on working conditions and health. That I don't know if you have here in Canada survey on working conditions and health. In the European Union, there is a survey on this matter in the different countries and for the whole union. And also few bilingual journals that do not allow an important part of the research to really be more to have a broader distribution in other countries. So at the end, I could show you some information, some data about the research and development expenditure according to the World Bank as a proportion of the gross domestic product, and you could see that it's in general very low in all the countries that we have data. For that, the only exception is Brazil is the only one exception with more than 1% of the gross domestic product invested in research and development. But all the other countries would hardly have 50.5% of the domestic product. So that was my last slide, and questions are welcome.
I'm just going to walk the mic around here.
Thank you. That was very interesting. I'm wondering, different countries have different like institutes that have physicians who specialize in occupational health or industrial health. I'm wondering what the situation is for Latin American countries, whether that's a specialty that the population has access to if they do become injured in industrial settings.
Yes, well, in general, I would say that it's very common in many Latin American countries to have this system named social security, the social security system, but that usually protect workers from private industry. So it is split. In general, the type of population that is covered by the different systems. So in the private industry, those workers are usually covered by the social security system, and government employees are protected by another system. So there are some protection, but there are also some issues that hasn't been addressed, such as the small companies, the small and medium size, basically small and micro size companies are not usually accomplished with the legal requirement for having the employees subscribed in the system. So that is one problem, and another problem is that there has been an increasing number of persons working in the informal market, and those persons are not usually covered. So at the end, some of these systems of social security covered between 30% or 60% at the most of the working population. And there are some other systems as in Chile and Argentina, but I'm not very familiar with the proportion of workers that are covered under such systems.
Probably the only exercise I'm going to get today. Thank you very much. I'm struck by parallel issues between Latin American countries and even here in Canada. terms of the gender distribution of the workforce that persists here, the underrepresentation of women in higher positions, including at the universities, and also the unpaid paid work distribution. Those issues persist here as well, so it's interesting to look at those comparisons. In terms of a question, very early in your talk about the International Congress that was held on women, work, and health, you mentioned one of the issues they talked about was common instruments and indicators. So I'm wondering if there is something that came from that Congress, resources about common indicators and instruments for research purposes, if something came from that.
Yeah. Well, we share some instruments there, and basically there were interest for the survey on working conditions and health. And that survey has been applied in collaboration with the International Labor Organization in Mexico and in Dominican Republic. And it seems to be extended, but it hasn't up to now. So, but that was some of the items from that survey have been shared and have been used for women in their own countries, but not in a national survey scale, but in an occupation, or just to identify the main risk factors and the main health outcomes. Yeah, but there were much interest, and they were interested to maintain linked and communicating with these type of developments, but it hasn't been really possible to maintain communication between the groups. But yes, that's something that we really need.
I'm going to ask a question because I got the microphone. I'm curious. You've been doing this work for a long time. I'm curious to know whether or not you think things are getting better or worse, or they've stayed the same for women workers in Latin America.
Well, there are different. They have been changes, but unfortunately not as many changes as we need. So there are laws, for example, in Mexico that demand the parties that have at least 50% of the candidates for positions must be women, and that is not something that is really accomplishing. So we have more laws, more institutions. There is the Institute of Women in many countries, and there are some work done at that level. However, for example, in Mexico, one of the worries and what we work in that book that came from a meeting on chemical exposures and gender, or something like that. I put that at the end of one of the first slides, and the main discussion there was that even when there are some progress looking at some of the main problems like harassment or that lack of rules that are clear for women that could advance in their careers and so on in the public sector, because mainly these organizations have a very important role in the public sector. So the topic of, or the focus on gender haven't gone through the main substance of this area. So that happens in environment and in health sector, and in each sector, the focus on gender hasn't impacted their day-to-day responsibility. You know, has impacted already the organization per se, but not the matter of what they work with. So there is a lot of work to do as well in that way. And things have changed, as for example, a new law for protecting domestic workers. New laws have developed in some countries, and then you have another different cases where the women came without so much protection. But I think that actions have increased and in some way have improved. But the problem of unemployment and underemployment had affected very much not only women but men and families, and that is a big problem. So the informality that.
I'm just curious. So I think you presented a lot of the work that you had been doing. You're now living here in BC. And so I'm curious about the work that you're currently doing, either, I guess, locally or with international groups about some of the work that you're currently doing.
Thank you. Well, I'm working in 2 projects basically at this time, and both of them not in Canada, because I'm still a visitor now, so I cannot work here. So one of the projects that I'm working on is related to chemicals, because that is one of my fields. So there is this initiative named SciCom that I don't know how many of you are related with. So this is a strategy for reducing chemical exposures up to the acceptable level, and to manage chemicals with the highest way of responsibility over them to be accomplished by 2020. And that's a voluntary initiative significant for many countries, and there are some resources around to work towards that goal. And one of them is related to chemicals in products. So there has been work and discussion and looked into the countries and between the sectors on how the chemicals that are included in the product could be, well, first of all, known by all the users, and how this could be known even for the producers, because to manufacture a product, it has very many steps, and that now those steps are done or accomplished in different parts of the globe. So it is a problem to finally know what we have in each product. And then once that is one part of the problem, but then the other part is, if we know all the list of the products that are of the chemicals that are in the products we use, how we are going to use that information. So it's only it is a matter of know which products would be should be known, which, to give some advantage for that. Well, that is there is a lot of work on that, and there is a group from the University of Massachusetts that is working on this big proposal from UNED, and I am contributing in looking at how is this, how are the conditions in some of the countries for dealing with some parts of the problem, for dealing with the information for the users and the information to the producers. And the other project is related to something like 8 years program of monitoring COPs in Mexico, persistent organic pollutants in Mexico in different media. So that was it has been a project that has gone on for some years. Now they have a good amount of data on that, and want to have an evaluation of what they know and what they need to know more about the distribution of this type of pollution. So those are basically, and the other one is related to network, working on stress issues, and basically using the instrument of developed by the Danish, the COPs of you. So we have been working on that and getting the opinions of a huge group, well, more than huge, diverse group of researchers from different countries that have made to the instrument. So we are now putting together all the comments for the next meeting, and that's going to be next year. So those are the work that I'm working out.
Okay. Thank you very much, Leonor. Much appreciated.
Thank you.